research shows, and we're seeing it every time we go to the ACR, every time we go to EULAR, we're seeing the word remission, and we're like, what? And remission is happening to the people who are getting the diagnosis early, who are getting the treatments early, which is why this is so important. But that's not the norm. It's not the norm. And too often we get a detour on our road. That is one of these main issues of why we're not getting diagnosed. So Danielle, why don't you talk a little bit about that point?
So I think that really breaks into two parts. First of all, as a patient, you have to know that you need help. And for me, that was a huge hurdle. And at the beginning of my journey, I was a kid. I didn't know anything. But even if you just limit it to when I was an adult and I was going to see my own doctors, you only have ever existed in your body. You don't know what other people's reality is like. So I thought everybody had chronic pain. I thought everybody was tired all the time. I thought everybody had random fevers that popped up out of nowhere. Like, I didn't know that was unusual. That was the first thing. And then when I did start asking for help, my doctors would go, oh, there's something wrong with your shoulder, go see an orthopedist. There's something wrong with your knee, go see an orthopedist. Nobody sent me to a rheumatologist for years and years and years. And in point of fact, when I did finally end up at a rheumatologist, it's because a radiologist came back and said, look, I pulled this patient's MRIs for the last 3 years, and I think this is RA. And that's when an orthopedist finally sent me to a rheumatologist. So even just recognizing that I needed to see one was a huge problem.
And then the other, go ahead.
Sorry. And then the other part of it is, once you know that you need to see a doctor and you're sitting in front of one, getting them to listen to you can be a huge problem. You know, most of the people who take a long time to get diagnosed, like you guys, have seronegative versions of things. And I know we're going to talk about blood work here in a bit. That wasn't me. When they did finally test my blood, I had rheumatoid factor positive. I was ACPA positive. I mean, my blood work was screaming, this person has a rheumatic disease, but nobody ever tested it that whole time. So we know that some members of the medical community have bias that they're not aware of, and they tend to downplay women's pain. And like 90% of people with rheumatic disease are women. They tend to downplay pain from people of color. They tend to downplay pain from children. And when I first started saying, I don't think I can walk if you don't do something about my knees, I was 14. And to me now, this is crazy, but I was given prescription strength arthritis medicine. It was called Vioxx. It's not on the market anymore. When I was 14 years old, but nobody thought maybe we should test her blood work. Like, it's weird for a kid to have this much pain, but I think they gave me that script to shut me up because they thought that I was making it up, or they thought I was exaggerating, or something like that. So getting a doctor to listen to you can be a huge hurdle. If anybody had bothered to order a test, they would have found it right away because it wasn't hiding. But, nobody did. And the other thing that I heard a lot of was doctors who wanted to put stipulations on treatment or even on investigations. So they would tell me things like, well, I want you to try a vegan diet and then come back and see me if it doesn't go away. I think you might have food allergies. Let's try elimination diet and then come back and see me if it doesn't go away. Probably you need to exercise more. I even had one guy tell me that women's anatomy was more prone to muscular dysfunction and I should try yoga and then come back and see me if it doesn't go away. As my disease progressed and I became less and less mobile, then it started being about my weight. Well, lose 10 pounds and then come back if you're still hurting. None of that should have ever happened. The minute I showed up in their office and said, I am 16 years old, I'm 23 years old, I'm 31 years old, and I am in pain all the time, they should have ordered tests. They should have ordered imaging. We shouldn't have to beg for someone's attention.
Kerry, I could just see it. You're like, I go for it.
So much of everything that you said, Danielle, I just feel so much. And so I want to start with that first thing of we have to know that we even need help and how much we don't realize is actually a problem. Because now I said earlier, it took me 8 years to get an accurate diagnosis. That's 8 years from when I started trying to get one. 8 years from when I said, hey, I think there's something wrong. We really need to look at this. But when I think back, and I've talked about this before, I used to say I always had a bunch of what I called random achy pains. They didn't belong to anything. They were unassociated with anything. They weren't for any reason. I just hurt in different places at different times for no reason. And I thought that was just life. I was just at an arthritis conference and I heard from so many other patients who said the same thing. They were children and they were told, oh, this is growing pains. I was then, later on, even once we got to a point where the doctors finally said, okay, yeah, maybe there is something wrong with you. They weren't very interested in finding out what. And it took until there was something completely undeniable. 4 years of me telling them about my pain, my fatigue, my, struggles with dizziness, with balance, all of those kind of things. That didn't mean anything because it didn't show up on a lab report. It was only when, after 4 years of saying, doctor, please help me, to a whole lot of doctors, it was only then when my feet swelled up so big that I couldn't put shoes on, that I said, look, I am not making this up. Depression didn't do this. And that's when they finally said, okay, you have some kind of arthritis. It's probably autoimmune. Here's some steroids and have a nice day. And then, he had no interest in doing anything further than that. He didn't tell me how dangerous steroids could be. While they are helping with certain things, they are seriously hurting with others. I know you mentioned earlier that, you just got the hip replacement. So did I just a few months ago. And the primary reason, I have, as my rheumatologist calls it, a little bit of RA. I have a little bit of Sjogren's. I have a little bit of other, inflammatory things. My primary diagnosis is a rare inflammatory disease called sarcoidosis that, does also cause, musculoskeletal sarcoidosis or arthritis. But the primary reason, what got so far beyond bearable, was that I developed osteoarthritis and avascular necrosis. And for anyone who isn't aware, avascular necrosis is basically when your bone begins to die because it's not getting the blood or the oxygen that it needs to survive. And the reason that happens, long-term steroid use and osteoarthritis. And what's one of the big causes for osteoarthritis? Well, what steroids do is they, one of the side effects is excessive weight gain. I gained over 100 pounds. But at the same time as it makes you gain weight, it also makes your bones weaker. That's a really bad combination. And if I had gotten a proper diagnosis earlier, I would have gotten proper treatment earlier. And as much as I love my new hip right now, I might not have needed it if I was able to get diagnosed when I should have been.
Absolutely. I'm looking at notes that we all take before we start, and the growing pains for the kids. And, we've all heard, oh, well, we talked about you must be depressed, or you obviously hurt yourself at the gym, because I was an athlete and I kickboxed and I played sports, and even they didn't believe my inflammation for a couple reasons. Well, my blood work was negative, so we'll break out here and start talking about that. And I was very, very thin, muscular, athletic, and I knew that that my foot hurt inside my shoe. I knew that my foot was swollen because I couldn't tie my shoe. It wasn't fitting correctly, but visibly they weren't seeing it. Like I said, I was very, very thin and bony, and it probably just looked normal. But I was telling them that I couldn't put my shoe on, and that wasn't registering because I didn't have any clinical, measurable presentation that they could find. And so one of the things that we will talk about in a continued conversation with this is a little preview is there's going to be a continued conversation here next month on the next continued discussion of this on our Roomy Rounds episode, where we're going to be talking to rheumatologists, bring them to the table, ask them why we don't get diagnosed, and see what advice they can give. But one of the top reasons is your blood work looks fine. So that's going to actually be the main theme of the next show. And I want to really bring this point up because to be diagnosed with some of our diseases, including rheumatoid arthritis, you do not need positive blood work. Do not need it. So all of the people out there who are messaging AI arthritis or talking to each other or talking to family members or whatever, you hear somebody say, well, the good news is I don't have RA because my blood work looked fine, is a false statement. If you take nothing from this episode today, that does not mean you don't have rheumatoid arthritis. Okay, so it can mean that you have worser disease because that is proof. Research has shown, Danielle, you mentioned you were at ACPA positive, rheumatoid factor positive. You don't need those to have rheumatoid, even though it's in the name. You don't have to have those. People can have rheumatoid factor positive and not have any of our diseases. It's a blood marker. In saying that, people with our diseases that do have these markers have typically worser outcomes, meaning they have more aggressive disease. They might be more difficult to treat. They might just have worser flares, that type of thing. And so that's also swinging back why I realized in the beginning, undifferentiated at sometimes, not always, sometimes it is a question mark, but also other times it can mean that you have milder onset, which if you snip it and you get treatment for it, that is actually could be a good thing. In my journey, undifferentiated why, Kerry, I feel that I thought it was a bad thing was because they told me, similar to what you were told, I can't treat you, is what they told me. I can't treat you until I can figure out what this grows into, what this becomes, a full-fledged disease. So they were basically telling me you don't actually have something. You have something that is not treatable. But once I got educated, I went back and realized there was treatment guidelines, not great ones, but there were guidelines that said I should have been treated with some mild disease-modifying agent. And I was denied that. And guess what? I got worse. Things got worse, a lot worse. And I do look back a lot today and say, I wonder if there were people like Danielle, like you, Kerry, like me, like a lot of us here at AI Arthritis, like the people that you were just at the conference with, Kerry, our friends, the people we talked to, if we could unite and create some kind of guide, some kind of navigation, something for these people who are coming into AI arthritis and saying, I don't have answers. We've got to start somewhere. And I feel like, why not start with the people who are the experts, right? And that is us.